The purpose of this video is to explain how to complete a mouth check. The mouth check is a simple tool that helps you identify any problems within the mouth of a child or young person. It should be completed by a staff member at their special education setting and should take place monthly or at intervals as suggested by the oral healthcare team. Before you begin the mouth check, make sure you have the right tools to hand, including a light source such as a pen torch. This will help you see clearly inside the mouth. PPE, personal protective equipment. This may include gloves and a mask, but please follow the most up-to-date guidance on what to wear. The mouth check form acts as a step-by-step guide to check the mouth. The mouth care guide assists in completing the mouth check form, ensuring the correct red, amber or green rating is given. A toothbrush, which may be useful to help keep the mouth open whilst carrying out the mouth check. You may find it helpful completing this check with a colleague for assistance. Once you have the right equipment, complete the first section of the mouth check with any relevant medical conditions the child and young person may have, any obvious dental problems, and any changes to eating, sleeping or behaviour, which may indicate that the child and young person is experiencing toothache or discomfort from the mouth. If the child and young person is able to communicate with you, you can ask them these questions and complete this section together. Be systematic in your approach when looking at the different parts of the mouth. It might be helpful to start on the outside of the mouth and then lift the lip to look inside the mouth, paying careful attention to the tongue and all of the soft tissues. These are the pink areas of the mouth and include the inside of the cheeks, the roof of the mouth, and underneath the tongue. You can then move on to the gums, saliva, and lastly, the teeth. Depending on the ethnic background of the child and young person, the colour of the soft tissues and gums may vary from pink to brown. Using the mouth check form, look at each part of the mouth and pick the red, amber or green description based on what matches most closely with what you can see. You can use the mouth care guide as an example of what to look for inside the mouth. Make a note of any additional findings you may see in each part of the mouth, here in the box below the relevant part of the mouth. If for any reason the mouth check could not be completed, for example a lack of compliance, this information can be included here. Once you have completed the mouth check, pick the highest risk rating from all the areas of the mouth, green, amber or red. This will act as the overall risk rating. To conclude, complete this section with the information of the staff member who has completed the mouth check and input the date for a month later to indicate when the next mouth check is due, unless an alternative date is suggested by the oral healthcare team. Always remember to lift the lip and include a mouth check as part of any other general checks. You have now completed this video and should be able to successfully complete a mouth check.